Hi and Assalamu alaikum. This is the second episode of Imaging Expert Pakistan. Today we have got Moloud with us, and I think you all know that Moloud presented in Radiology Society of Pakistan recently, and her topic was DWI in a small ball, and she compared the DWI in 1.5 and 3 Tesla. Malood is one of the lead radiographer. She's the lead radiographer in one of the Alliance Medical site, and she has done her master's in MRI, and she has a quite good experience overall in MRI. So thank you so much, Malood, for joining us.
You're
And
welcome.
can you just introduce yourself?
Hi everyone. I'm Moloud Ghazi-Torbati, and thank you so much for inviting me for both the meeting and this session. It's really pleasure, to connect to my brothers and sisters in Pakistan. And so, as Syed, introduced me, I'm the lead radiographer in one of the MRI center in Alliance Medical. I work in Tenet Diagnostic Center. And also I'm MR Safety Officer for Alliance Medical. I've done MRI for about 12 years, and I'm really enjoying this job. And with the progress in MRI, it's just make the time even more exciting.
Thank you so much. Thanks for joining us, Maloud. So we'll go to the topic now. We start with the DWI. I know that this is a very basic question, but I'll probably ask it for the student radiographers who are watching this episode. What is the DWI and how does it work?
Yeah, so basically, do you want me to share the screen so you can
Yes,
see
you
my
can. You can.
presentation?
Yes, Maloud.
Okay, let me just get the image about DWI.
Sure.
Okay, here we are. So basically, diffusion weighted imaging is all about the mobility of water molecule, especially when the mobility is restricted to a specific orientation. In MRI, the motion of water molecule by diffusion through a magnetic gradient will result in an irreversible signal loss through the intravoxel dephasing. But if we have a restricted movement in due to edema or inflammation or other pathology, we will get the high signal. So is that enough? Is this what you expect?
That's fine. How does it work in abdominal imaging then?
Yeah, because we get usually in abdominal, in small bowel, basically, we get inflammation or other pathology which shows restricted diffusion. They will show a high signal in DWI and low signal in ADC map. And we can just play, with the B value, because the higher B value, you get more signal to show the pathology better.
Okay. Okay. So except the difference in magnetic strength, what are the other differences in 1.5 and 3 Tesla? Because you have compared your images on 3 Tesla and 1.5. So can you just little bit?
Yeah, as I discussed earlier, in the meeting, because when we have 3 Tesla, as the strength of the magnet is higher, we get the better signal to noise ratio. And these images, which I took, in our centers, this is the proof. You can see this is one slice, of a small bowel imaging using DWI in 1.5 and the corresponding slice in 3T. And as you can see, it's very obvious, you have more signal, all about here compared with the 1.5 image. So this is one advantage. The other one is, which I go to the next image, is about contrast to noise ratio. As we have better signal, we get the has got impact in resolution and contrast to noise ratio as well. Again, this is an image from our center, 1.5. If you compare the 3T image, you can see the contrast between tissue is much higher than the contrast tissue in 1.5. So both signal to noise ratio and contrast to noise ratio better. And also we get the faster imaging because we can use parallel imaging, and the factor of parallel imaging can go higher in 3T as well. So we get the faster imaging, which especially something like a small bowel in the abdomen or any MRI in abdomen area, if you can make the imaging faster, It means you're reducing motion artifact and any physiological movement artifact.
Perfect. So, which means that it not only decrease the scanning time at 3 Tesla, but also gives you more signals as well.
Yeah, definitely signal is the biggest advantage, you know, to do DWI in 3T.
And how did you compare the DWI on the both scanner? Did you use the same parameters?
Yes, exactly. We scanned 4 patients. So we scanned in one scanner and we only repeated DWI in the other scanner. Well, I kept all of the parameters in DWI exactly the same so we can have a true comparison.
Perfect. And how was the outcome? What did you find? Which one is better and why?
Yeah, so again, if I just move to the images, yeah, as you can see, this is the image from the actual patient we scanned. In T2 axial, in 1.5, we scanned the patient. You can see inflammation here. The corresponding, signal is in 1.5 in this area. You have some signal. But then when we scan patient in 3T, is nearly same slice. It's not exactly, but generally the signal in that area is much higher. But this is about a big lesion, you know. There was another interesting finding in this patient, because when the radiologist reviewed all of the images, he has seen some signal in lower down, you know, and this is a subtle lesion. In here, you can see the signal, but if you didn't see the 3T and you only rely on 1.5, the signal is not great here. So, so it's not only is about the more signal in for a bigger lesion is more important when it comes to a small lesion. So 3T has got the more ability to pick up the small lesion compared with 1.5.
Okay. And do you think any disadvantage of using the 3T, like any artifacts or anything else, like we should then prioritize to do the scan on the 1.5 Tesla?
Yeah, again, if I go back to the slices, there are 2 disadvantages with 3T. One is SAR, so the SAR is higher,
Yeah.
but at least I'm a GE user. I can see GE used in they're introducing new technique, which can reduce the SAR. You know, we're using higher TR to reduce SAR, and also because the parallel imaging generally you can use the higher factor in 3T. Because as you know, if you're using parallel imaging, so you're losing some signal. And that's why it's important, you know, which factor you're going to use. But when you're using parallel imaging in 3T, because you already have so many signal, just because your scanner is stronger and has got more signal, so you can use the higher factor of parallel imaging. For example, in 1.5, if I go maximum to factor 2, in 3T, I can go to 3. And because you can use the higher factor, you can make the images faster. And as you make the images faster, so obviously you can reduce SAR. So in theory, the SAR is higher in 3T, but then there are other factors can contribute. And as a general, you can still keep the SAR reasonable. So this is one thing. And the other one is about this dielectric artifact, which I explained, you know, in the presentation. If you like, you can refer to that. You see some signal dropout, you know, because of the dielectric effect. But again, I'm a G user. G has just recently, you know, provided all of the sensor with dielectric pad. Unfortunately, I didn't put any picture, but in future I can add a picture. It's just like a pad, you know, and has got gel, and it could reduce the dielectric effect. You just put it on patient abdomen just below the body coil, your torso coil. So there are some challenges, but fortunately there is a way, you know, to minimize these effects.
Thank you so much, Marus. Thank you so much for your time again. I will appreciate if you have got.
Yeah, it was a pleasure, you know, to be with you. And then also motivated me to study more about MRI, make more presentation, because it's really rewarding, and hopefully we can help our other colleagues, you know, we just need to make the practice better, and it's not one person's job, it's a group, effort. So, and especially when we connect to other countries, it's my pleasure, to work with you guys as
It was
well.
nice talking to you, and I would appreciate maybe in the future with the new topic, will if you can give your time to us, and that will be our pleasure.
Definitely. Thank you so much.
Thank you so much. We are going to end this episode now. We'll come with the next episode soon. Thank you so much.
Okay. Thank you so much. Bye.